Good morning and welcome. My name is Fred Cate. I'm the Vice President of Research at Indiana University, and I am very pleased to welcome all of you to the Indiana State House this morning for a major announcement. It involves the state of Indiana, Indiana University, and our close partner, IU Health. And the announcement concerns IU's Grand Challenges program, our bold commitment to partner with businesses, with government agencies, and local communities to address some of the most pressing issues facing Indiana and the nation. In June of 2016, President McRobbie announced that Precision Health would be Indiana University's first Grand Challenges initiative. In May of this year, we announced our second Grand Challenges project, Prepared for Environmental Change, through which IU, backed by a broad bipartisan coalition of government, business, not-for-profit, and community leaders, is helping to deliver actionable solutions to communities across the state of Indiana to help them proactively prepare for environmental change. Today, we are proud to announce IU's third Grand Challenges initiative, a statewide partnership that will help address one of the most urgent problems facing Indiana and the nation. And now to introduce Indiana University's third Grand Challenges initiative, please join me in welcoming to the podium the 18th President of Indiana University, Michael McRobbie.
Thank you very much, Fred. To begin with, I'm very pleased to welcome three members of the Indiana University Board of Trustees who are with us this morning. With us, Trustee Mary Ellen Bishop of Indianapolis, Trustee Phil Eskew Jr. of Bloomington, and Trustee Harry Gonzo of Indianapolis. Please join me in welcoming the trustees of the university. And I'm very pleased to welcome a large number of elected officials who are with us today. And I'm just going to introduce all of them, and if you could hold your applause until I've introduced them. With us today are State Senator Jim Merritt, Senator Jean Breaux, Representative Milo Smith, Representative Karen Engelman, Representative Tim Brown, Representative Todd Houston, Representative Randy Linus, and also the Chief Justice of the Indiana Supreme Court, Loretta Rush. Please join me in welcoming all of them as well. And I want to also welcome three senior members of Indiana University who played a vital role in the development of the initiative that I'll be describing in just a moment. With us today are Lauren Rebell, the Executive Vice President and Provost of the Bloomington campus, Nessa Padar, Executive Vice President and Chancellor of the IEPOI campus, and Jay Hess, Vice President for University Clinical Affairs and Dean of the School of Medicine. Please join me in welcoming them as well. As one of the nation's leading public research universities, Indiana University has, in recent years, made powerful investments in research designed to inform public policy, to establish new protocols for the prevention, treatment, control, and cure of disease, pain, and suffering, and to contribute to the quality of life in Indiana and to state and national prosperity through the creation of new industries and new jobs. One of the most visible of these investments is, as Vice President Cate just mentioned, IU's Grand Challenge program, which in the years leading up to IU's bicentennial in 2020 will invest in a number of major multidisciplinary research projects aimed at finding solutions to the grand challenges of our time, solutions that will provide major improvements in the quality of life for the people of the state of Indiana and beyond. This morning, I'm very pleased to announce that Indiana University's third Grand Challenge initiative will be responding to the addictions crisis. Distinguished Professor Robin Newhouse, Dean of the IU School of Nursing, will serve as the initiative's principal investigator. As you know, drug addiction is a major public health crisis that is taking an increasingly severe toll on the health of far too many Hoosiers, and it is devastating communities throughout Indiana. In 2014, more than 1,100 Hoosiers died from drug overdoses, marking a 500% increase since 1999 and placing Indiana 15th nationwide for drug overdose fatalities. Indiana is one of 4 states where the fatal drug overdose rate has more than quadrupled since 1999. In fact, drug overdoses have risen so sharply in Indiana that they overtook the number of motor vehicle deaths in 2008. The situation is so severe nationally that it is expected that a decrease in the average life expectancy of Americans, something usually only associated with countries ravaged by war, famine, or epidemics, will occur over the next few years. And in 2016, more people died from drug overdoses in the United States than the total number of Americans killed in the Vietnam War. Through IU's vitally important new initiative, which we announced today, the university will partner with Governor Holcomb and the state government, with IU Health, with Eskenazi Health, and with a number of other organizations to urgently address the pervasive and grave substance abuse crisis in Indiana and throughout the United States. This initiative will be the nation's largest and most comprehensive state-based response to the opioid addiction crisis, and the largest anywhere led by a university. Governor Holcomb has identified addressing the substance abuse crisis as a key priority for the state and has identified aligning the resources of the state, including its universities, as a critical step in achieving that priority. IU's efforts to respond to the addiction crisis will be aligned in this way with state and federal government efforts and will include collaboration with the Indiana congressional delegation, local communities, industry, NGOs, patient groups, and many others. IU greatly appreciates the opportunity to partner with Governor Holcomb, the state, IU Health, Eskenazi Health, and others in this vitally important initiative. This new Grand Challenge initiative will have a budget of $50 million over 5 years. Of this, around $13 million will be deployed immediately over the next 6 months in over 10 separate projects in the following areas. We will work to address key issues in substance abuse prevention, early intervention, treatment, recovery, and enforcement. We will expand education, training, and certification to address the significant shortage of addictions professionals, not just in medicine, but across healthcare, social work, and in related professions. We will bring to bear IU's considerable expertise in data collection and analysis to turn data into actionable intelligence for health providers, government agencies, employers, and community organizations. We will deploy IU's expertise in policy analysis, economics, and legal reform to reduce the availability of opioids in medicine cabinets and on the street, and to inform decisions made by our state's elected officials. We will focus IU's basic, applied, and translational science on a better understanding of addiction mechanisms and expand research into non or less addictive treatments for pain to reduce the demand for illicit substances and ultimately reduce the prevalence of substance abuse disorders. And we will focus on community and workforce development and expand IU's partnerships with communities to enhance their responses to the addictions crisis. This initiative will also fund the hiring of 10 new IU faculty members, various other scientists and technicians, and the work of dozens and dozens of students each year on IU's campuses. This initiative will also leverage IU's extensive statewide footprint, including the IU School of Medicine and all of IU's other health sciences schools, as well as all of IU's regional campuses which stretch from the north to the south and from the east to the west of the state. It will bring together IU's formidable and extensive clinical, research, and educational capabilities, working in partnership with IU Health to achieve maximum impact in addressing this urgent state and national crisis. It will also leverage the vital expertise concerning these problems at other units and schools within the university, including the School of Public and Environmental Affairs, the Mauer and McKinney Schools of Law, and the Department of Psychological and Brain Sciences in Bloomington's College of Arts and Sciences. Indiana University is certainly not immune to the crisis. We are all hearing almost daily about more deaths and impacts of this devastating crisis. It affects IU faculty, staff, students, alumni, and their family, friends, and neighbors. People are dying, and we must act. Now is the time to bring to bear the resources of all IU campuses to help address and mitigate this destructive and deadly public health crisis. And now I invite you to turn your attention to the screens for a video that highlights the Responding to the Addictions Crisis Grand Challenge initiative.
Nick and Jack were 18 months apart. They were a year behind each other in school, and I would say that they probably were best friends. They played hockey since they were about 3 years old. They played their last 4 years of hockey together. Nick and Jack had gone to a party the next morning. I walked into Jack's room and was talking to him. Didn't really get a response from him, so I shook him to wake him up, and that's when he didn't wake up. I checked his pulse and checked his respirations, and of course there was none. And I picked him up and I initiated CPR and then called for 911. Nick was in the basement with some of his friends. They had gone to awaken Nick to let him know, and Nick was lifeless as well. They were underage drinking, and they also had experimented with some opioids. They made a choice to take one of the pills and didn't wake up the next morning. I still can't believe that they would make choices that they did that night. This can happen to anybody. No families are untouchable.
The challenge posed by addiction in Indiana today is enormous and unprecedented. Opioid abuse is at an all-time high. Abuse of other substances is rising at an alarming rate. Alcoholism continues to shatter families, and the size of the problem is rivaled only by its complexity. Now's the time to act for our state, for our communities, and for the people we love. That's why Indiana University's Grand Challenges program is partnering with Governor Eric Holcomb and his administration to tackle Indiana's addiction problem head-on. Overcoming this crisis will take a complex, far-reaching plan.
Attacking the drug epidemic is a key focus of my administration.
It starts with equipping and training those on the front lines of this crisis.
We're focusing on prevention, early intervention, better training, and certification programs so more health professionals can help fight this epidemic.
We must understand and respond more effectively to the root causes of this problem. We're taking a strategic approach and improving the use of data to reduce the prevalence of substance use disorder and help those who have an opioid addiction recover and become or return to being productive, contributing members of their communities. To do this, we're pulling together the best resources this state has to offer.
We are attacking this crisis on all fronts. We are taking action to reduce the availability of opioids and provide Hoosiers with more treatment and prevention programs.
We need to understand not only the science behind addiction, but also the policy and economic issues that affect it. If we're going to break the cycle of addiction, we must address economic opportunity, jobs, and community development.
It will take teamwork, including local communities across our state. Working together, we are expanding partnerships and introducing new resources that will help end this crisis.
These areas of focus will reach families across our state and help those who need it most. Critical change, life-saving change, so that Hoosiers everywhere know that help and hope is on the way.
Where there's hope, there's a chance to save lives.
I'm very pleased that we are joined today by Becky Savage, whose deeply moving story you just heard in the video. So please join me in welcoming Becky and her son, Matthew. Following the loss of Nick and Jack, Becky and her husband Mike founded the 525 Foundation to help educate families about the realities of substance abuse and drug overdoses. The 525 Foundation gets its name from Nick and Jack's hockey jersey numbers that you saw in the video. At the time of his death, Nick had just finished his freshman year at Indiana University. Becky, through the Grand Challenges initiative we are announcing today, we honor Nick and we honor Jack. We at Indiana University are grateful for all that you and your family are doing, and we are proud to be working with you to end the scourge of drugs in Indiana and throughout the nation. And now it is my pleasure to introduce the principal investigator of the Responding to the Addictions Crisis Initiative, the Dean of the Indiana University School of Nursing, distinguished Professor Robin Newhouse. Dr. Newhouse is one of the nation's most distinguished nurse researchers and is widely recognized for her leadership at the Institute of Medicine and at other national professional organizations. At Indiana University, in addition to her many other responsibilities, she chairs the steering committee that developed today's Grand Challenge proposal. So please join me in welcoming to the podium Dr. Robin Newhouse.
The addictions crisis that we face is complex, and our response to reverse harm caused by the addictions will require many strategies applied together, strong partnerships with individual leaders, organizations, patients, and our community. President McRobbie described how this grand challenge would focus resources on all Indiana campuses and schools in 5 key areas. The steering committee, appointed by President McRobbie, has recommended an initial set of projects in each of those areas that leverage current work, with a second round of projects suggested in May 2018. Let me describe the issues we will target first and why they're important. Our leaders and community have told us that to attack addictions, they need real-time data. Examples include opioid prescriptions filled at multiple pharmacies by the same person, or admissions to the emergency department across Indiana related to opioid use. Together, we will develop robust data infrastructure that link data together to support evidence-based and data-driven solutions with real-time evidence to all elements of the addictions crisis. When asked if we have enough clinicians to address addictions, we fall short. Together, we will address the critical shortage of professionals across health and non-health care fields who are trained in evidence-based approaches to recognize, prevent, and address opioid addiction and overdose. Our leaders and policymakers locally and throughout the state and communities to acute care health settings are seeking evidence-based policy solutions. Together, we will develop evidence-based policy recommendations to improve the impact of policy and law on Indiana's addiction crisis. Our patients and the people in the community want to know how addictions happen to them and their families, and clinicians ask if there are better ways to care for people with addictions. Together, we will develop a deeper understanding of the neurobiological, social, behavioral mechanisms that underlie addiction and pain response to addiction in community context. Our community is eager for engagement to help address addictions. We will work together with our communities across Indiana to build resilience and capacity by addressing the gaps in the addiction workforce and local state levels. Through this grand challenge, we together will reduce the incidence of substance use disorder. Together, we will decrease opioid overdose deaths. Together, we will decrease the number of babies born with neonatal abstinence syndrome. Thank you, our community, for joining us in this battle with addictions.
Thank you very much, Dean Newhouse, and thank you very much for agreeing to be the principal investigator of this major new initiative. Our next speaker is Dennis Murphy, President and CEO of Indiana University Health. As the largest hospital system in Indiana with other hospitals or other medical facilities in nearly every part of the state, IU Health stands in the front line of this crisis. Mr. Murphy joined IU Health in 2013 as Chief Operating Officer, overseeing the operation of IU Health entities throughout the system. Indiana University collaborates extensively with IU Health on many initiatives. And we are especially pleased to be working with Dennis and his colleagues to address the addictions crisis facing our state and nation. So please join me in welcoming to the podium the President and CEO of IU Health, Dennis Murphy.
Good morning. I'm very proud to stand before you today and on this stage with Governor Holcomb, President McRobbie, Vice President Kate, and Dean Newhouse as we launch a new partnership to combat the scourge of the opioid crisis that has struck Indiana like it has the rest of the nation with such intensity and destructive force. As the largest healthcare provider in Indiana, we see the impact of this terrible disease every hour of every day somewhere in our system. In our emergency rooms, where the use of life-saving naloxone has tripled over the last 5 years. In our maternity units and newborn nurseries, where the number of babies born every year with neonatal abstinence syndrome increases. In our addiction treatment centers, where as much as we try, there are waiting lists for care that can extend months long. As the state's largest healthcare provider and its only academic health system, we know we have a special responsibility and an opportunity to support and complement and partner with IU in undertaking this ambitious and vital initiative. It is through this partnership with IU Health that the university's faculty, physicians, nurses, and other clinicians will be able to test new therapies and treatments for this terrible disease of addiction. It is through IU Health that access can be increased for treatment, not only to substance abuse issues, but also broader behavioral health services, since we know that there is a close relationship between the connection of addiction and other mental health issues such as depression and anxiety. To expand capacity today, we have already begun to integrate behavioral health services in our primary care clinics to help treat addiction and other behavioral health issues. However, as we continue this expansion, We must note that Indiana has a struggle to provide an adequate supply of behavioral health and addiction providers. We need more professionals to meet the demand caused by the growing number of patients with addictions, and Indiana University today and in the future is helping to grow that pipeline. Another option we have to increase capacity is to leverage technology. We're already making investments in significant expansion of telemedicine to manage these patients, not only to get people care quickly, but to get people care where they live and to manage our current workforce shortage. Finally, it is the partnership with IU Health that the prescribing of opioid pain medications will be reduced. To start, we've updated our electronic health records to support compliance with new state limits on opioid prescriptions. But more importantly, we've been persistent in the education of our providers and students on the prescribing risks of opioids and the alternatives for pain management. Last year, IU Health has been able to reduce the number of opioid prescriptions by 20%. We're not finished, but this is certainly an important start in decreasing the use of opioids statewide. We at IU Health look forward to working closely with IU and our colleagues there to achieve the goals of this grand challenge. We give full credit to the university's leaders for dedicating its unique capabilities to solving one of our most serious and vexing issues facing the state. The chances are you know someone or some family member that has been touched by this terrible epidemic. That's because the disease of addiction knows no boundaries, economic or demographic. Communities in urban and rural settings, small and large, across the entire state are grappling with this terrible illness and its consequences. But in keeping with the finest elements of our Hoosier traditions and values, we are committing today to rolling up our sleeves and going to work together to tackle this problem and to reduce significantly the human and societal impacts that this terrible disease has brought upon this state. And I look forward to this partnership. Thank you very much.
Thank you very much, Mr. Murphy. And now it is my pleasure to introduce the 51st Governor of the state of Indiana, Eric Holcomb. A lifelong Hoosier, Governor Holcomb recognized quickly the extent of the tragedy that is the addiction crisis in our state. In his State of the State address in January of this year, Governor Holcomb identified solving the addictions crisis as one of the key areas that his administration needed to address in order to move the state forward. And he stressed the importance of aligning all the resources of the state, including higher education, as a critical step in achieving this goal. After listening to this excellent address, I sent the governor a note pledging Indiana University's support in that fight. The governor responded almost immediately, and we met shortly thereafter. Since that meeting, our colleagues have worked together throughout the spring and the summer, identifying those areas where the expertise and resources of Indiana University could align most effectively with Governor Holcomb's fight against addiction. Governor Holcomb, we are grateful for your leadership and for your resolve and for the opportunity to partner with your administration in this vital fight. So please join me in welcoming to the podium Governor Eric Holcomb.
Thank you, President McRobbie, most importantly for your longstanding leadership at Indiana University and for your commitment to attacking this drug epidemic that we all face. This grand challenge is accepted. I also see it as a grand opportunity to do what we do best and confront the issues that face our state. When our administration did first take office, as you alluded to, back in January, we did we made attacking this drug epidemic one of our, if not the highest priority. And to be completely candid with you all, I must confess I didn't realize it early on in life and just how big this issue was, just the breadth and the depth of this crisis until really early last year, when Hoosiers started sharing with me their most personal stories. It seemed like everywhere that I went, and it quickly became apparent for me too that this crisis affects everyone, all socioeconomic levels, all races, all backgrounds, and substance abuse can work its way and has worked its way into all of our communities in all 92 counties. As was also alluded to, we've got mothers who are shooting up in hospital parking lots before giving birth, and we've got PhDs who are popping positive on drug tests at the workplace. And yes, I do also fully realize that this isn't a Indiana-centric, or it's not unique to our state, this problem that we all face. Every state, I know from talking to my cohorts from coast to coast, feels like they too are ground zero, and understandably so. Sadly, we all know that this drug epidemic, this crisis that we face is a personal one. It's also a family one. It's also a community crisis, and it has morphed or evolved into a business crisis as well. Everywhere I go when we're talking about workforce, this creeps into the conversation rather quickly. So what do we do? As many of you know, as I look out at those seated and standing, I've had many conversations with many of you, and as one of my first acts as governor was to create a position as standing up an executive director of drug prevention, treatment, and enforcement. We're very pleased to have, who you saw on the video, Jim McClellan, serving in that state role. Jim's leadership has already proven to be instrumental in the recent strides that we've taken both legislatively and administratively. We've done many, many things. We've expanded the number of treatment centers. We've given locals the authority and the ability to initiate needle exchanges. We've limited opioid prescriptions, and just last week we launched our Next Level Recovery website, an online entry or a portal, if you will, for all state resources on the opioid crisis we face to be easily not just accessed, but easily updated. We want folks, whether they're struggling with addiction or their loved ones or the caregivers, to have easy access to solutions. We're attacking this epidemic on all fronts with an all-hands-on-deck approach. And I must say and commend, we've seen unprecedented cooperation so far, federal, state, and local governments, the private sector, nonprofits, and of course, the reason why we are all here today from higher education. President McRobbie, this new commitment, the grand challenge from Indiana University is simply put going to save lives. We talk a lot about teamwork. You've already heard that this morning, and the team that you've assembled on the steering committee for the grand challenge is an impressive collection of individuals and talent from any university in our country. And our state is grateful for their commitment to not just this project, but their willingness to serve in this most needed area. And the $50 million grant is going to help them fill so many of these key areas that you articulated in the fight against the forces of addiction. From education and training to data collection and analysis to community and workforce development, Indiana University's grand challenge is going to go such a long way to help turn the tide against this crisis of addiction and it is going to give more hope to the far too many hopeless. I've often said that if I could do but just one thing as governor, accomplish just one major thing, it would be to bend the trajectory of opioid abuse down and stay on the road to recovery as a state and as a people. And that's really what's so encouraging about today. I know now, because of this historic commitment from Indiana University, the arc is starting to turn downward. Thank you, Indiana University. We're going to beat this thing together. I just know it. Thank you.
Thank you very much, Governor Holcomb. Thank you for your leadership. Thank you for your commitment to seeing this fight through, and thank you for the partnership of you and your administration in seeing this fight. Ladies and gentlemen, please join me in thanking the governor. Indiana University is very proud to partner with you, Governor Holcomb, and with you, Dennis, and your colleagues at IU Health, with the General Assembly, and with so many others, our many partners, on an initiative committed to saving lives and mitigating the horrendous impact of substance abuse in Indiana communities. We invite all to join us, and we thank you for being part of today's announcement. An announcement like today's takes a great deal of work, and I would ask you to join me in thanking all of the many people who have made it possible, not just those seated here, but mainly the ones standing all around the sides there, if you would join me in thanking them. We invite all of you to join us for refreshments, which are in the back, to further discuss our shared resolve to tackle this crisis. For members of the press, the platform party will be available for the next few minutes to answer questions right around the corner here. Thank you again very much. Thank you for being with us, and thank you for being part of this collaborative campaign to end the addiction crisis in Indiana.